afternoon, everyone. I am Christina Andrews, the Senior Director of Professional Services, and I am joined by my friends and colleagues, Raianne Melton, who is the Senior Director of Clinical and Professional Services. Welcome, Raianne. Wendy Amerson, who is the Director of Hospice Sales. Welcome, Wendy. And Rosena Clarke-Turner, who is our Senior Implementation Consultant. Welcome, Rosena. All right, so we are here today to talk about HOPE, iQIES submission, the keys to success. So really when we lean in and we think about advancing the quality and consistency of hospice care across the country, one of the most transformative developments is the implementation of the Hospice Outcomes and Patient Evaluation Tool, something that y'all may have heard of called HOPE. This is designed by CMS, and HOPE really represents a significant shift towards standardization, real-time data collection that really supports the patient, our true north, in patient-centered care, as well as performance measurements. So today we are going to explore how HOPE is shaping not only the clinical practice, but improving symptom management for our patients as well as the families, and informing quality reporting. So I'd like to set the tone and turn to one of our panelists who has been speaking about HOPE probably in almost every state and nationally, Ms. Raianne. Would you mind taking a moment and providing us with an overview of the HOPE tool, really its purpose, the structure, and how it fits into the broader goals of hospice care improvement?
Pardon me, happy to, Christina. So just to level set the playing ground here, let's just a reminder that HOPE is intended to really extend his data collection and move it from a retrospective data time point to really an active assessment of the patient in the first 30 days of care in hopes of really informing that plan of care and meeting the patient's needs to improve patient outcomes and to improve caregiver satisfaction. When we look at some other goals of HOPE, and the primary one is that it's going to help CMS refine what a pay-for reporting feature like value-based purchasing. So, you know, we can look forward in the next 5 or so years to where we will be going to, hospice is going to experience just what home health is experiencing currently with value-based purchasing, where CMS looks at the HOPE data, claims-based data that they would get from the hospice care index items, and look at CAP survey, hospice CAP surveys, in order to determine and create a payment adjustment per Medicare episode for hospices. So that's in our future. Currently, what we have in place is still that 4% decrease in reimbursement, the penalty for a year if you do not meet the HQRP, or the Hospice Reporting Program's reporting requirements of submitting 90% of HOPE data within the 30-day time point for each time point data collection. And that's why we're here today. It's not only about submitting that data, it's also about ensuring that your data has been accepted. A couple of other key points that I just want to remind you of in regards to HOPE is that, remember, when on October 1st, HOPE data will be collected for every patient admitted to any Medicare certified hospice. There's no exceptions for age. There's no exception for payer. It is every single patient admitted will require a HOPE assessment at the time points. Another important thing, the hospice final rule for 26 was just published, and they affirmed that HOPE will begin on October 1st of 25. You know, we thought, and you know, most of the feedback provided by agencies, organizations, and organizations like the Alliance recommended a delay in start, and CMS said, we understand your concern, but we're going to start on October 1st. And then really thinking about that HOPE will affect clinical activity, it will affect operational activities, but really why we're here today is talking about that technological impact of switching from keys to iQIES.
Yes, so our why, the foundation. Raianne and I had a quick conversation yesterday regarding the fact that we worked in the industry for very large organizations. And so what happened behind the scenes supporting us, you know, with the submission of HIS is now happening again behind the scenes as we are transitioning from our legacy system, KEYS, to the new, modern Internet Quality Improvement and Evaluation System, so iQIES platform. So there's a lot that takes place behind the scenes, and that's why we've invited Rosena and Wendy to join us, because they're really going to take us down that journey today regarding the technical components, because as Raianne mentioned, it is the foundation of how you are going to report, access, and also manage that patient care data going forward. So Rosena, I'd like to transition to you and get us kicked off with the technical components, really helping us understand the impact of this transition. So can you walk us through why CMS is requiring the move to iQIES, the keys with a little I in front of it, with HOPE, and what providers need to know about registration and identity proofing to the role of provider security, like the official?
I love that you call it the little I, Christina. The transition to the internet component of it, for those of you who've been in home health, you've already done the transition. This is part of Medicare's planned rollout to eventually archive the key system. So it's not new, but we're one of the last of the Mohicans to be brought into Medicare's overall regime for that internet-based modern, moving away from the VPN kind of area and moving us to access everywhere, anytime with this cloud-based system for maintaining the functions that are needed for data submission and reports utilization. It's also moving Medicare away from, once you logged into the keys, you had that fragmented approach for where do you go to put keys data, where do you go to put CASPA, where do you find aspirin reporting. Medicare is doing away with that as a part of its planned rollout to be able to manage this. Now, part of this complex question, that's the part of the why. Let's look at the other part that looked at what providers need to know about registration and identity proofing. So what Medicare is doing is going to HARP and using Experian for its single sign-on for access and roles in all of its platforms. So HARP through Experian is that place where that remote identity proofing is occurring. So what it allows is for the profile information to be developed, for the account information and two-factor identification that is going to be critical to be able to access iQIES. So that's the first step. What do you need to know? It is that identity proofing is established now through HARP, the HARP tool for documenting anything that's gone away, and that HARP enrollment is going to be essential to be able to log into iQIES. So no longer will people be required to log into CMSnet with a HARP registration. They will have that HARP user ID, the HARP password, and the two-factor identification that's going to make it critical for keys. removal to iQIES inception. Okay, so now what's important about the third part of this complex question? What's important about the role of the provider security official? It is important that that HARP registration occurs now. What Medicare is doing, it is requiring there's one security official for that organization, but it's requesting that you have two, part of emergency preparedness. Something wrong with somebody else is there to provide that function. But that initial enrollee as that security official will be the one that is responsible for connecting your PTAN, your CCN, whatever you want to call it, into iQIES, and that person or those persons will have the responsibility of accepting, approving all of the other roles that will be required in iQIES for management of the data, just the same way that it was managed in QIES. So that's a really critical point. And the other portion of this is Medicare is really saying, hey, get this done by September 10th. Because if there are delays in it, you may have issues and challenges going forward. So that's why it's extremely critical for the provider security officials to be designated now. And then for all of the other users in your agency, in your organization, to be enrolled in HARP for that remote identity proofing to allow access into QIES. I hope that answers your question, because in addition to the provider security official, those other roles that are going to be crucial is that assessment submitter, that provider administrator, that provider assessment coordinator. So there are other roles that are going to be necessary, but it starts with the security official, who's then going to be able to accept and deny those other roles for smooth transition and data submission and report access. I hope that answers your very complex question, Christina.
It did, Rosena. So my two takeaways is start now, designate the provider security official, and then the other takeaway is that the little iQIES, is really creating a more elevated user experience compared to the previous platform. And you brought something up during your education as it relates to that question that now I want to turn to Wendy. So what happens with the existing data in QIES? And for those home health agencies who are using iQIES, do they need to register separately for their hospice provider?
Question. So the existing data will remain in QIES, and actually it's imperative that agencies keep up with that access, because for the May 2026 refresh, the preview reports are going to go into the old QIES system. So make sure keeping that access to the old QIES system, and plus also with the HIS data submission period through February 15th, 2026. Any of those modifications and activations would be done through the old QIES system. So October 1st, you can't just shut off QIES. You got to keep that compliance, that system available also. The other ports will be migrated to iQIES on October 1st. The provider reports that are currently in QIES, as far as the admission and discharge reports, those will be combined into one report, into iQIES. And then those will include the HUB visit information. So, really kind of using iQIES for your history and your hospice compare provider preview reports, and then your iQIES for those new admissions, the HUB data. And as far as for the home health agencies, they will need to register separately for hospice. So there will be those kind of two distinct registrations. But for those that were involved with registering for home health, the process is pretty much the same, same information, same steps to follow. So should hopefully be pretty simple if you're used to doing it for home health. But there will be the need to register separately.
Okay, excellent. Well, thank you for clarifications from both those.
And Christina, if I might add something, one of the things that Medicare has assured is that they're going to have 10 years of data transitioned over by October 1st, and then they'll do the subsequent data movement over time to QIES, from QIES to iQIES. That's what the guidance is suggesting. We'll see what happens.
The crystal ball. The crystal ball.
Yeah.
So how many virtually had no issues submitting HIS documents, right? So now I want to lean into that successful submission process, because we've got a lot of experts here virtually, and talk about, you know, the lessons learned. I mean, we all have lessons learned, really, as it relates to that past reporting. Particularly the challenges that many providers face with timely submissions using HART, which is the Hospice Abstraction Reporting Tool. Say that 5 times real fast. And submitting the hospice item set to IQIES. You know, so from the credentialing delays to the misidentification errors, to just the real impacts on compliance and data integrity as a whole. So with this transition, we do have an opportunity to learn, to think about what didn't work well previously, but only if we anticipate what we need to address. And that's really about us being honest with our organization and what friction points we have to address early. So in thinking about Rosena in her past life being a surveyor, and then Wendy also being in industry, I wanted to talk a little bit about some of those friction points. So Rosena, I'd like to start with the first component of this. So highlight the impact of how delays in the request for log-on credentials and credentialing associated is going to lead to errors for organizations. So talk to us a little bit about how the delay in that's going to create errors.
Oh, thank you so much for the question, Christina. One of the things that we really want to stress is the rationale for starting early. You really should be in HARP right now, because even though it should be a smooth process, because it's identity proofing related, there are some situations where it may not be an automatic user ID identification. And so some people may have to go through a manual process for getting their HARP ID and their password. And that could happen for multiples of reasons. Wrong social security number inputted. They don't have a credit history that Experian can work on. May you have used a nickname or any of those other kinds of things that would compound the issue of getting that HARP ID, which was going to delay the ability to access iQIES. If there has to be a manual process, there is no guarantee how long it will take. It will take as long as it takes, because then you will have to go into the manual process. I'm just going to be really brief. It's a matter of providing one of 3 forms of government IDs, producing a pass, all of those other things which will be necessary to verify that you are who you say that you are. So it's really important that that starts early in the process. Now, the other component of it is the assigning that PSO pretty early as well, and making sure that that person who is designated with that responsibility is accurately identifying that organization with your CCN or your PTAN, whatever you call it, because those are other issues that may cause delay as well, because the MAC is at the level where that first approval is given, and then that PSO would be responsible for managing all of the other requests for roles that come in. So those are critical points. If those things are not in place, then obviously you're going to have delays in being able to submit and transmit your data timely and accurately. Just for starters.
It sounds like getting a driver's license or a passport might be a little bit easier than this process. So start now.
Passing the identity, yes.
What about fact ID misidentification? Talk to us a little bit about that.
Your fact ID is something that Medicare is going to carry you throughout your tenure and being connected with Medicare. So that doesn't usually change once that's assigned by the MAC. But one of the challenges that sometimes occurs is that in your software, if you misidentify your fact ID with something else like your EIN instead of the fact ID, those are things that can cause delay as well. And then, of course, if you're not in the habit of looking through your validation reports as well in a timely manner, those can lead to tremendous revenue take back, like Raianne talked about initially, because if it's not received, it's not submitted, and it's not accepted timely, it's going to affect your bottom line.
Yeah, yeah. So when we think about this transition, when it comes to operationalizing and maintaining compliance, Wendy, based upon your experience, what are some things that come to mind as it relates to the anticipation of this transition?
Yeah, I mean, I think really, one of the biggest areas of opportunity is to ensure that someone, maybe multiple people, depending on, size of agency, amount of records being submitted, are really reviewing that final validation report, and especially the timeliness report on a very frequent basis. I mean, if not at least, weekly, maybe twice a week, again, depending on how many submissions. I've, thought about one of a scenario that we had with an agency that I worked with, and they just, were saying that they were submitting them. We took it at what it was worth, and then kind of logged in to, do some additional kind of, data analysis, and realized that it was about August, I think, and they were only 65% timely. And they weren't very high in census, didn't have a lot of admissions or discharges. So we had to essentially work backwards and say, okay, so from, August to December 31st, you have to submit, this X amount of number of HIS records to get you to 90%, or you're going to, face the, and this is at that time it was 2%, you're going to face that penalty. Luckily, we called it in August. I think they maybe got to like 91%, right at the end of the year. But really having somebody kind of, own that, take that ownership, and then really knowing that, kind of what we're doing today is going to impact that payment in 2027. So, yeah, a lot of what you're doing today, you might not be at the agency in, 2 years, you may be somewhere else, but really knowing that, what we're doing today is going to impact, 2027. And really that, those reports can, be your best friend, staying on top of those. I want to kind of, echo, the importance of that PSO that Rosena is referencing, that if for some reason that PSO leaves, making sure that there's now a replacement. Everyone knows who that is, and there's that, kind of, we always know there's a change of administrators, all the forms we need to fill out, notification, but making sure that that step is done. So then when there needs to be, additional users added, we're not trying to get the PSO who's no longer employed to approve it. And then same with any sort of, vacations, holidays, making sure that, you've got those kind of backup folks identified to make sure there's no, anything falling through the cracks when it comes to, timely submissions.
Yeah. Curious, Rosena and Wendy, do you have any best practices as it relates to training opportunities for organizations? So when you think about identifying the first PSO, all of the other additional roles and what they need to do to truly lean in and learn the iQIES system together, anything top of mind that we can offer right now? And Raianne also had too.
Medicare has a plethora of resources online, and we'll provide you with some of those in I think at the end of this webinar as well. But if you go to the HARP, website, it's going to have you go through the steps. If you go to iQIES and try to log in, it's going to send you back to HARP to say, do what you need to do first. So, and then there are videos that even YouTube videos that define what the process is like step by step to be able to get you organized for the technological readiness for HOPE and being able to do that. One of the other things, whether this is somewhere or not, to pay attention to, and I think one of our presenters in the last webinar addressed this, there is a significant difference between when an activity is completed and when it is submitted. That is not going away with HOPE. So the admission assessment still has to be completed within 14 days. The discharge still has to be completed within 7 days. The submission is 30 days from that. So that's something to remember and keep as a part of your best practices. The completion date for that activity and the submission date for that data point, they're different. and Hope is not changing that. So utilizing the resources, and then to go into your, your partner in terms of your submission of your data and your system manager for all of your care, to be able to see what resources are inherent there already, to be able to utilize that in conjunction with Medicare related resources. And I'm shutting up now on that piece.
Wendy, Raianne, anything to add?
Raianne, I'll let you go. I think you maybe had something to add earlier.
I do have something to say. Thank you, Wendy. So, when Christina and I talk about this, I laughingly said, I had people who did that for me. So I'm a big picture gal, like I'm really great at the vision for our business, for the vision of our care. I would not be the right person to be selected as the PSO, right? I would be, and neither would Christina, with all the love in my heart. I mean, that's the way our brains are. So having, being able to identify the strengths in your team, like, Wendy, I'm going to tell you, Wendy and Rosena are my detail folks. Whenever I need someone to take a deep look into something I've done, I go to them because they're going to go look into the details that maybe I have missed, because that's the way they work. So really looking at someone who has that skill, that detailed skill, and somebody who's highly engaged. They know why it matters. They know the impact that it's going to have on the agency is so very, very important. And I'll turn my soapbox over to Wendy.
Yeah, no, I mean, I think back to kind of the any tools or anything. When his kind of first rolled out, I remember our clinicians were like, "What is this mess?" And we kind of just gave them like a laminated, like 5x7 card that they could kind of keep as far as to get credit for pain assessment. You need to choose 5 characteristics. So little things like that clinicians can throw in their pocket, refer to. So that really this just becomes second nature. I know for me that would be something extremely helpful. I can pull it out, look real quick. I know some folks are all electronic. Some folks want to have that paper they can just check off. So really knowing catering to your staff's needs, how they learn best, resources for them, and then not forgetting as new staff come in the door that maybe haven't worked with hospice, they don't even know what HIS is, and now there's this hope thing. Really making sure that spending that time with especially again staff that have never worked in hospice, and really getting them to understand what it is, the impact, the detail of it, the timelines, all of those things can really just help make sure that all the other things down the road are just much more smooth.
Yeah. I love it. I love those 2 elements. So Raianne, I'll use my term persona, making sure as an organization you are selecting the right person to drive this process with the right subcommittee individuals. I would actually think of this like a committee, so, and maybe it also needs to be included in your performance improvement plan within your QAPI program because you've had some issues with HIS submissions. Just throwing that out there. So persona is going to be key, and then training is the next element. And I know that we at Axxess, we talk a lot about training, and we have provided a lot of HOPE training, and we are going to be providing you all with additional education and training links at the end of this session today. So to Wendy's point, if you are hiring new staff today that have no idea what HOPE is, you will be able to, at a click of a button, bring them up to speed quickly. So I want to transition into something that most of us might know, HQRP, which is the Hospice Quality Reporting Program, because we've talked about that 90% submission quite a bit throughout our conversation, and that dreaded 4% reduction in payment, because our landscape continues to evolve. And, with the final rule, what was it, Raianne, 2.6 increase, with the payment? I mean, we know that doesn't cover what we do. I mean, it's.
Yeah, and Christina, we were talking about this, I think yesterday. that 4% impact reduction is so common now that when hospice published the final rule in the Federal Register, they published the base rate plus the rate with the 4% reduction.
Never had seen such. I mean, when I was like, oh my goodness, wow. Yep. So I think that's why, we were passionate about launching this conversation today, because we cannot express enough how iQIES is going to play that central role in ensuring timely, accurate, and compliant reporting, because none of us, thinking back to when I was in industry, can afford that 4%, per Medicare episode. And then the other thing too that Raianne and I have talked about a few times, organizations were used to submitting 2 records, right? Now we're going up to 4 within that 30-day time frame, depending on if the patient passes during that journey. So that is a significant shift in expectations. And so again, going back to that persona and training, that perception is key. Start today, pick your PSO, right, Rosena? Like start today.
And more importantly, I like what you're saying about persona, because you need a hope champion.
Yes.
In your organization. You need a hope champion, and training cannot be isolated. Everybody needs to know how each aspect of their work is going to impact the overall outcome, so that it is not a siloed kind of approach to training, but you pick your champions, get them educated, utilize the resources. CMS has 2 different hope training components out there on the web, but you find them, and then you take everybody who's going to be involved in the process, and you have them understand how their role is going to impact this agency's ability to be compliant. With the SFV component of it now, and that having to be done within 2 days of the symptom impact being a moderate or severe, there's some issue for clinicians, but there's also some issues for the biller, and also some issues for the person who's going to be doing the hope submission. So training cannot be isolated. It must be comprehensive, based on utilization of a hope champions, plural, to be able to make sure that everybody understands their role in compliance.
I love that, identifying the hope champion. Yeah, brilliant. Brilliant. So let's think about that hope champion, and let's bring it down to the last theme of the conversation today that really supports the HRQ, HQRP component aspect of that 90%. So going back to what I had said, moving from 2 to 4 records, what should organizations do from an operational perspective to prepare for this? And I'd like to start with Raianne as it relates to operational components.
Sure. Well, the first thing I would do is I would check with my EMR vendor to see how are they going to approach helping me to ensure, 1, that the visits are done on time, and 2, that there's some sort of trigger for that symptom follow-up visit, right? And we mentioned this on the last webinar. If your organization is not enforcing point of service documentation, especially in this first 30 days, you're likely putting your team at risk. For, you do your admission and that documentation isn't done, and if your EMR is doing the completion of the admission to trigger that SFV notification based on the completion of the record, and that record isn't finished for 7, 8, 10 days, no one may remember that there was a symptom follow-up visit that was required within 2 calendar days of that admission. So that's really going to put your organization at risk. So from an operational point of view, you really need to have, we should do this for the entire time someone's on hospice. But I'm going to tell you now, you really are going to have a heightened awareness on completed documentation in that first 30 days if you're going to be, there's so many opportunities to fall out of compliance with these HOPE visits.
Mm-hmm. Mm-hmm. Brilliant points. Brilliant points. Rosena, from a credentialing, because it seems to be your love language with this particular topic. So what should organizations consider, when they're preparing for submitting up to 4 records from a credentialing perspective?
You summarized it initially in the beginning. Start now. If you haven't gone into HARP, go now. Don't know if there will be delays for whatever reason as a part of your identity proofing. Do it now. Go ahead and designate 2 people for that PSO role, okay? Ensure that all of your users who are going to have anything to do with HOPE data transmission, ensure that they also have gone through that HARP process and that they go in and request their roles once the PSO has set up that organization affiliation. I can't stress that more emphatically. One of the things I want to add to what Raianne talked about operationally, if you've been in the habit of having less than 1 visit a week for your hospice admissions, stop. You will be out of compliance. A minimum of 1 time a week for 4-week frequencies will assist in that process already. Okay. So I dabbled in operations too, but I'm a dabbler.
With your surveyor hat. All right, Wendy, data validation, your love language. So, how would you lean into this question?
Definitely, yeah, and I think, kind of like Rosena, I kind of have to piggyback with Raianne because, operations, data validation, they really go hand in hand. So just making sure that, people are, again, reviewing the records even before, submitting, whoever's that kind of final approver, making sure they kind of know what they're looking for, making sure that, again, reviewing those reports in iQIES, looking for any trends that may happen, certain clinicians documenting, certain way, because maybe they haven't gotten any HOPE training, they're not quite sure, how to document. And then, really kind of, I think, to the point of all the additional visits, instead of scheduling that HUV1 on day, 14, scheduling it, day 6, the second one on day 7. So you have that wiggle room, if you need it, you're still in the time frame. And then again, really just, identifying kind of those backup people, about the PSO, having your PSOs, also having, the backups in place, whoever's going to be submitting, do they have the backup, when there's a, PTO, again, holidays, that everybody knows who needs to kind of step up. And again, and not, waiting till, I know some folks, one of our agencies, they wanted to wait, just, hey, we're going to submit everything on Friday afternoon. But if you've got records signed and ready on Tuesday morning, submit them, don't wait, and really with the, I was the poor soul who had to be the one to get the VPN, log in, submit our HIS records. iQIES seems like it's going to be a whole lot more timely. So again, as soon as you get them, submit them. Looks like the reporting is going to be faster. So just, with the streamlined, ways that iQIES going, don't wait, submit, review the information timely, and then, make any corrections as needed.
Can I ask a clarifying question, Wendy? So, we're talking a lot about submission, but what do you recommend in terms of ensuring that those submitted records have been accepted?
I would, if I submit on Monday, I'm logging in first thing Tuesday morning. Some of the FAQs that, CMS has put out around kind of HOPE and the reports in iQIES actually say that they'll be essentially real time. You'll submit and you can go and run the report. So if that's true, I would submit and then I would go run that report. If not, I would definitely make it part of, again, whoever it is that owns it, that's part of their process. Again, same day, next day, first thing, and then kind of, review line by line. If you submitted 10 records yesterday, you should have, a record of 10 being accepted or rejected or whatever. Make sure there's just that kind of, match as far as number submitted to number reported on.
Great question, Raianne, because I was thinking.
I was just going to say, what I'm hearing though is that that time early submission, because if something gets rejected, you need the time to make the corrections for resubmission.
Yes, ma'am. Absolutely.
Okay, thanks. Sorry, Christina. I didn't mean to cut you off.
I mean, I think we're kind of right there. So where I was going with it is thinking back to my operations day, we used to conduct stand-up morning meetings every morning with our leadership. And everybody was responsible for reporting on key elements of the business. So I could see Wendy, that PSO, being responsible for bringing the report and saying, this is what I've submitted, this is what's been accepted, or this is what's also been rejected. I'm going to be working this queue today to make sure we're on point. So I guess, you know, when I think about the one thing that, aside from persona, the one thing that I would think that I would want to offer to the virtual audience today, based on this discussion, is maybe consider what your stand-up operational processes look like and how you can incorporate potentially that best practice of that report, showing you that you are compliant or showing you your issues. So my key takeaways would be persona and that follow-up component. So now I want to ask the panelists here, you've all said a lot. What would be the one thing that you would want our virtual audience to walk away today to be sure that they implement? So Rosena, I'll start with you.
And I'm going to actually take a Wendy offshoot on this one, is that recognizing that for acceptance of those records, that there is a system and a numerical system for when something is inactivated and resubmitted. So paying attention to key field and non-key key field corrections that are going to be required as a part of that acceptance of that record time frame. So that's one of the things that I'd like to highlight in terms of recognizing that there are situations where things would have to be inactivated or modified. And there is a process for that in keys that whoever is addressing those issues for your organizations need to be aware of, and they need to follow the script.
Lovely. Wendy.
So we have a little saying in our house, and it's called be a proactive Polly, not a reactive Rita. So I think that the echoing theme is being proactive, doing everything earlier, don't wait. To your point, Christina, as far as, stand up, we all reviewed mission reports, looking at that admission report and then knowing, okay, so in 30 days, if they're still in service, we should have those 2 HUV visits. And, again, if it's a whiteboard, something to kind of just jot down, check, we did it, X, they didn't need it, whatever the case may be, but something where everybody can really just kind of, look at it, visualize it, and again, just being proactive polys with that information.
Proactive polys, I love it. All right, Raianne.
So, CMS is going to start scrutinizing and evaluating HOPE submissions on January 1st of 26. And they're going to do that for that calendar year. And that is what's going to inform whether or not an agency is subject to a 4% decrease. So literally what they've done, and I don't know if they did it intentionally or if they even know, so let's keep it a secret. What they've done is given us fourth quarter of this year to get our act together, right?
Mm-hmm.
So we have from October 1st to December 31st to get it right. So what I would do along with registering in HARP and getting ready, I would also be looking at what are my pain points with HIS, because that's going to inform what's going to be your pain points with HOPE, right? And then be thinking about how you're going to audit this in October to get it right in November and December, so when January 1st comes around, you're ready to rock and roll.
I love that. And for those who know me, I'm not a sports analogy person, but you made me think about like football teams when they only have fourth quarter to make it happen. I think it's the fourth quarter, right?
Fourth quarter.
Yeah.
So we have the fourth quarter to make it happen. So brilliant best practice, Raianne. All right, so for all of our virtual attendees, I want to thank you for hanging out with us, listening to this conversation. We truly hope that you had some takeaway, actionable insights that you can begin to apply today, consider thinking about tomorrow. After this webinar, we are going to send you a plethora, that word, of assets, additional assets. The PowerPoint presentation of this conversation, so it's going to include details. So you can use it with your key leadership, have that conversation. It will help you walk through transferring today's education to your team. We're also going to provide to you the link for training and certification. And this is going to offer you and your organization a free CEU with Hope educational courses. So you can check that out, as Raianne and I mentioned earlier. And then we're also going to include email links for HARP registration, in addition to the Alliance website for their best practice components and the CMS Gov website for their best practice components. So we're going to package this all up together as our give back to you for thanking you for joining us today, in addition to the recording of the webinar. So thank you, panelists. Thank you, attendees. Have a blessed rest of your Wednesday. And fourth quarter, we got this. Thank you all.
Thank you for joining Axxess On Demand. Visit axxess.com for more on-demand videos, industry resources, blogs, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.